Today, we're shedding light on a challenge that many cancer patients face but is rarely talked about: changes in taste due to treatment. Studies show that nearly 80% of cancer patients experience taste changes or alterations, which can make eating a struggle and impact overall nutrition. A new educational program called Tasting Notes is stepping in to help. Now, joining us today is registered dietitian Abby Reiser, who specializes in oncology nutrition and is here to help cancer patients navigate these changes and rediscover the joy of eating again. Good morning, Abby. How are you?
Good morning, James. Thanks for having me. I'm thrilled to be here to discuss tasting notes.
I'm glad to have you with us too. So let's get started. Can you start by explaining why cancer treatments often cause taste changes?
So, taste, touch, and smell are experienced when sensory cells in the mouth or nose send signals to the brain, and many cancer treatments can interfere with the function of those cells. In addition, some treatments can also damage the nerves that send signals to the brain.
Now, why is maintaining proper nutrition so crucial for cancer patients, and what risks do they face if they struggle to eat well?
Eating well while on treatment is critical. For those who are able to eat well, they have a greater likelihood of maintaining their strength, their energy, and their weight. Weight maintenance is especially important while on treatment because if you lose too much weight too quickly, the medical team may need to reduce the dosage of the treatment or even hold the treatment. Proper nutrition also has the potential to boost their immune systems, help them fight infection, and help them to better tolerate treatment-related side effects.
Now, tell us about the Tasty Notes campaign. What inspired it, and what resource does it offer to those undergoing treatment?
The Tasting Notes campaign was created by Johnson & Johnson, who I'm here in partnership with today, and it aims to provide support for patients who are experiencing taste changes due to cancer treatment. It's inspired by the fact that taste changes are one of the most common side effects of treatment, yet one of the most difficult to manage, given everyone's experience with it is so different. So there's really no one-size-fits-all solution. So on the Tasting Notes website, which is gettastingnotes.com, you will find a tip sheet with nutrition recommendations to help prevent unintentional weight loss, as well as recipes that are specifically designed for patients who are experiencing taste changes.
Now, Abby, you've participated in a video series as part of this campaign. What kind of tips and recipes can viewers expect to find?
So in addition to the tip sheet is that 3-part video series, which features myself and world-renowned chef and cancer survivor Grant Achatz. And the videos provide tips on adjusting to life with taste changes, engaging other senses to enhance flavor, and overcoming social challenges to help maintain meaningful connections through food.
Now, Abby, where can cancer patients and their caregivers go to find more information about the Tasty Notes campaign and support for taste changes?
Patients and their caregivers can go to the Tasting Notes website, which is gettastingnotes.com. And I also strongly encourage them to discuss this with their medical team. We're all here to provide support for them as well.
That sounds so good. Abby, thank you so much for joining us on Morning Blend. I love the layout you have. I wish I had that on my kitchen counter. So thank you again for joining us on Morning Blend.
Thank you so much for having me.